A proposed Tennessee law could change where you get your prescriptions. I'm 10 News reporter Alana Mutnick, and I'm sure you've seen this in the news already. It is Senate Bill 2040, and that bill, CVS says, threatens the closure of more than 100 CVS stores across the state. Let me break down that bill for you and what it actually means. The bill focuses on pharmacy benefit managers. Now, in simple terms, this is just essentially the middleman between the pharmacy, the drug manufacturer, and the insurance company. A PBM decides what drugs are covered, negotiates drug prices, and also decides how much the pharmacies are getting paid. Right now, CVS Health falls under the category in which they are both the PBM, which is CVS Caremark, and the pharmacy. This bill would say that CVS would need to choose between the two. They can't both be a PBM and the pharmacy. CVS says that this would devastate access and affordability all across the state, and it would also affect the upwards of 1.5 million patients in the state that they care for. On the other hand, community pharmacists like Max Pharmacy that I spoke with say that this bill, if it passes, would just level the playing field. Representative Rick Scarborough is sponsoring the House side of the bill, and he says that it is aimed at eliminating that conflict of interest. He says if PBMs like CVS Caremark are both reimbursing and regulating their own pharmacies and also competing pharmacies, that right there is a conflict of interest. Some also really important information to note is that a state audit released back in February from the Department of Commerce and Insurance found that CVS Caremark was actually reimbursing its own pharmacies much more than other pharmacies, sometimes up to 16,000% more for certain medications. It also found that Caremark was charging employers more than it was paying for some drugs. Still, in a very lengthy statement, CVS says that the proposed bill is bad for Tennessee, and it's simply not possible to not operate Caremark in the state. You can find more information at WBIR.com, and the full story will air tonight at 11 on 10 News.